Okay, everyone should be able to see my screen. Sherry, can you just confirm that you can see my screen okay?
Yes, all good on our end. Thank you.
Wonderful. So hello, everyone. So great to join you today as we look to our future of work, a future that we may not have envisioned a year ago. The focus of my presentation, as Sherry mentioned, will be business recovery from the pandemic. Now, back in 2019, if someone mentioned business recovery to you, you probably would have assumed they were talking about a return to a normal state, likely a normal state of business financial health. But in the context we find ourselves in, recovery is about so much more. It's about evolving to meet the challenges and opportunities of tomorrow, that new normal or next normal, so to speak. So the goal for the next 45 minutes will be to provide you with information that will aid you in that recovery process, so you can emerge as a stronger, more resilient, and sustainable business. Now, when you first look at this image, what are some of your thoughts? What reaction do you think the average observer would have to seeing this image, to walking into this scene? Maybe some would have a strong reaction and maybe others would have no reaction at all. Now imagine walking into this scene. I'm sure most, if not all of you, will be quite alarmed and will immediately flag the fact that the students are not wearing masks and they're not physically distanced. See, throughout the pandemic, our awareness of health and safety has been heightened on certain workplace risks, such as catching the virus, not just for ourselves, but for the people around us as well. Everywhere you go, the thought of being safe and avoiding COVID-19 is top of mind. This is a real culture shift that will likely have permanent implications similar to other major world events, such as the financial crisis of 2008. The unwavering commitment we've seen from our leaders, the daily communications on COVID prevention, and the consistent focus on health and safety has really brought about an unprecedented level of awareness and safety culture. The pandemic has also revealed a few gaps. Some businesses were not fully prepared. Many did not have strong emergency plans in place or sufficient mental health supports to ride the wave of COVID-19. And there's been a lot of focus in the media on what we've learned and what's needed to move forward. So to start things off, I'm going to share 4 keys to business recovery with you. And these will be key themes throughout my presentation. So the first key is a thriving workplace safety culture. Now at WSIB, we consider safety culture the degree to which health and safety is truly living and breathing in an organization. How safe do employees really feel at work? Do they feel they have a safe employer? Do they feel they have a voice in health and safety? And do they think health and safety is a top priority for their business? Let me tell you a little story about safety culture. A few years ago, I was engaging with a business. It was a manufacturing business in the West End of Toronto. Now, they were very concerned about complying with legislative health and safety requirements, so the Occupational Health and Safety Act. And they did a number of things to do that. They hired a health and safety consultant. They developed a number of health and safety procedures. They set up the Health and Safety Board, a joint health and safety committee. They ensured health and safety training. In their opinion, they had really checked all the boxes. But one day, very sadly, a worker actually did not follow the pre-use inspection for a piece of machinery, ended up using the machinery incorrectly, and sadly lost both of their thumbs in an accident, which was very tragic. This employer ended up being fined $70,000 by the Ministry of Labor, Training and Skills Development. They also appeared on the ministry's website, which is not a good thing. And there was other costs associated, not to mention how their employees felt about their colleague getting injured and the permanent changes to that worker's life. So as they reflected on this, they did not understand what had happened because in their opinion, they had done all that they could to prevent this from happening. But the problem was health and safety was really seen as a formality in their business, something that you check off a list. It was not a way of life. It was not a way of doing business. health and safety was not ingrained in everything they did. So it wasn't seen as a non-negotiable, and not every employee truly understood the importance of health and safety or were really bought into that. And so that's the importance of health and safety culture. Now, the other three keys, the first one is resilient and engaged workforce. The next one is strong and reliable supply chain. And the last one is a managed health and safety system. Now, some of you may not know what a health and safety management system is if you're not a health and safety practitioner. So I'll give you a quick definition. It's essentially a proven system of procedures, processes, and other measures that employees implement to promote continual improvement in health and safety. It helps you raise your existing health and safety program and your business to a new level of performance. So before we dive in, let's have a quick look at the data. Oops, sorry about that. Okay, so let's have a quick look at the data before we dive in. Now, before COVID, pre-COVID, employees were getting injured and becoming ill on the job every single day. COVID just adds another layer to that equation. Previously, there might have been less media attention, but the impacts were just as devastating. Now we're going to talk about lost time claims here. A lost time claims is really created when a worker suffers a worker-related injury, which results in being off work. A lost time injury rate is really the amount of lost time injury claims per 100 workers. So here we've got on the right-hand corner of the screen, you'll see that the average lost time injury rate is 0.98. And you'll also see that for the healthcare and municipal sectors, the lost time injury rate is 1.55 and 1.64 respectively, which is quite a bit higher than the average. Okay, so there's definitely an opportunity there. You'll also see that there's some common types of injuries here, falls on the same level, so that slips, trips, and falls. You can see also the occupations with the highest injury claims. So for instance, assisting occupations in support of health services, which would be nurse aides, for instance. For municipal, you can see it's police officers and firefighters, so our first responders are most frequently getting injured. And actually for education, it's interesting, it's cleaners. And I can only imagine how difficult that must be for those cleaners with all the added responsibilities right now with COVID, washing the floors more than they normally would, cleaning surfaces, and just how that's increasing the risk for them. So one thing I want to mention before I move on from this slide is, there was a recent a speech from the throne by the federal government that mentioned we owe an immense debt to our healthcare workers, and I think we all agree with that. The pandemic has made clear why Canadians need a resilient healthcare system, but in order for our healthcare system to be resilient, we need to safeguard the health and well-being of our workforce. We need resilient workers. So that's something that's very important to consider here. Okay, so let's go back to this image again. Let's have another look here. Thinking about this worker, you can see that there's some challenges here. Some of you maybe with health and safety backgrounds can see a few more. One thing I'll say is you should never be straddling a step ladder. You should never be on the top two steps. These are things we want to notice. We don't want to just notice not wearing masks. We want to notice every single hazard that can cause harm to one of our employees. So it's very important that we raise awareness of health and safety across all industries and for all risks and for all employees. And we need to address the root causes of these injuries and illnesses, because if we don't, our people will continue to get hurt at work. There's also going to be costs for us. Litigation costs, fines, costs to accommodating injured workers, costs to retraining, hiring new replacement workers. We will face disruptions to our operations, declined productivity, not to mention employee morale. No one likes to see their colleagues get hurt. Unsafe employers typically see increased absenteeism, poor employee mental health. There was actually a recent study by the Institute for Work and Health and the occupational health clinics for Ontario workers that found higher levels of anxiety and depression amongst workers who felt they lacked COVID-19 protection on the job. Our organization's reputation could also be at stake. We don't want the negative media attention that some businesses have received, which can be absolutely catastrophic. So we need to earn the public trust retain and attract clients, investors, and top talent. So this is why health and safety is so important. At the WSIB, we also have a safety check website. It's an open data portal where anyone can look at the health and safety performance of any business in Ontario. And more, we do find job seekers are going there. They want to know, is this a safe employer? Okay, so we have some good news. The health and safety program is here to help you. We can help you build that safety culture. We can help you with that managed health and safety system, with that resilient and engaged workforce, and with that productivity. Okay, so here's some of the ways the program can help you. Now, we launched this program at the end of 2019 to really tap into those 4 keys to recovery that I mentioned. Through the program, we will give you the tools and supports to build that strong, vibrant health and safety culture. Employees working in safe environments can focus better on their work, their clients, and for those of you in healthcare, their patients, because they're not going to be worried about their own personal health and safety at work. Schedule 1 employers can earn a rebate on their WSIB premiums, and they can also lower their premium rates through the program. For Schedule 2 employers, you can reduce your claim costs, which could lead to significant savings. You can also earn digital badges to strengthen your safety brand and really stand out amongst your industry peers, which is very important right now. And over time, you will see a return on investment. The preliminary findings of an Institute for Work and Health study on estimating the financial benefits to employers of health and safety prevention expenditures shows an average tangible and intangible return on investment of $1 to $3.21 for every dollar invested in health and safety. So that's a threefold return for some businesses. So let me tell you a little bit more about the Health and Safety Excellence Program. So the program has 36 topics across 3 levels to help you build a robust health and safety management system. And now this management system is aligned with the Ministry of Labor Training and Skills Development Accreditation Program. So each topic is essentially a building block towards that program, meaning as you implement these topics, you will also be implementing standards of excellence in health and safety, such as CORE 220 or ISO 45001. Now, the level 1 topics are really where you lay a groundwork for a basic health and safety system. You can see there's 10 topics at level 1. This will include many of the legislative requirements, but also going beyond that, because just complying with the law doesn't necessarily eliminate those injuries and illnesses in your business. As mentioned, we need to get at the root cause. So in this level, you're actually going to do a risk assessment, and that's going to help you identify and control the hazards in your workplace that are causing those injuries and those illnesses. Level 2 is where you start to work on your health and safety management system. So you're basically taking that health and safety program you've built in level 1, and you're better integrating it into your business, into your organization, into your operations, your processes, and all of your activities. And level 3 is where you're going to optimize that system. So it's truly working to prevent injuries and illnesses, and by continually assessing and controlling hazards and ensuring a continual improvement process. These topics, again, they are building blocks, a roadmap towards that ministry's accreditation program. Okay, so let's talk a little bit more about how the program works in terms of what would your journey look like through this program if you were to join. There's 4 key steps in the program that I'm going to walk you through: join, develop, demonstrate, and achieve. So the first step is join. This is where you're going to register with one of our 34 approved providers. Now, these providers serve different industries and offer different services, but all of them are going to work to guide you through the program and help ensure your success. Providers do charge fees. Now, the fees typically range from around $500 to $1,500 a year, depending on the services you choose. Keep in mind, though, Schedule 1 employers are going to get a rebate, also could get lower premium rates. Schedule 2 employers are going to reduce their claim costs, so you will see much more of a return here than what you're spending on your provider. Once you register, your provider will give you a link to our digital portal. That's where the entire program is housed, is through an online portal. You can access the program anytime and anywhere. And then you'll do a small or short health and safety assessment. This will take you about 15 to 20 minutes. And what it's going to do is it's going to tell you what level you should start at in the program and what topics might be best for you. Not all of you will start at level 1. Some of you may already have some health and safety plans in place. Some of you may even have a health and safety management system, and you may want to start at level 3 or even level 2. So the assessment will help you gauge where you want to begin. Now, once you've done that, you are going to pick between 1 and 5 topics for the year to work on. And this will basically be your action plan for the year. Let me walk you through some of the level 1 topics. So the topics with a star are the ones that I'm going to recommend for you that align closest with addressing the immediate impacts of COVID-19. So for example, risk assessment. In the context of COVID-19, this is where you need to identify where, how, and how often workers may be exposed to COVID-19 in your workplace. And then you can even break that down into low, medium, and high risks. This is a very key step in order to mitigate those risks. Then control of hazards is where you look at those assessed risks and you look to mitigate and control them. And this is where you develop those safe work practices to protect your people. Examples may include personal protective equipment, such as face shields, changing the way people work to include more distancing, cleaning surfaces, and eliminating certain transmission points, such as shared desks and equipment. Now, another topic I want to identify for you, because we talked about that health and safety culture, having a safety culture, leadership and commitment. As we've seen from the pandemic, dedicated leadership and strong commitment are paramount to safety culture. It all starts at the top. Leaders need to demonstrate in words and in actions that health and safety is a top priority. And this is what you can see happening in society, and you can actually take what's happening at a macro level and bring it into your organization by building that safety culture within your organization. Another topic that will really help with safety culture is worker participation. And this is an important topic to getting your employees more involved in health and safety. Let's look a little bit at some of the level 2 topics. This is the intermediate level. And these topics, the topics on the right here are ones we suggest you work on simultaneously as they're closely interlinked, and implementation of one of them typically goes hand in hand with the other. So for instance, our return to work topics, you probably want to do all 3 of those together within the same action plan. Now, I think it goes without saying that topics such as emergency prevention and preparedness and emergency response can help you address COVID-19 challenges. These topics will also help you prepare for future emergencies as well. It's really about looking ahead and thinking about what could negatively impact the health and safety of your organization and what can be done to prepare for and prevent those impacts. But let me call out one that I think is going to be very important to building that resilient and engaged workforce, workplace health promotion. This topic is really focusing on the mental health of your employees. It's something that you're going to want to invest in over time. So this topic will take some time to implement within the year. You want to really build in those health and safety, mental health supports so that when a crisis occurs, your people will be more resilient and better able to cope. They'll have the tools and supports in place to help them ride the waves. And it's really about investing in that psychosocial capital of your workforce. Another topic that really goes hand in hand with that resilient and stable, strong supply chain would be the contractor management program topic. This is going to help you ensure that contractors and anyone working with you, anyone that you're employing as part of your business, really is also prepared. So your contractors also need to have strong health and safety plans in place, emergency management plans, so they can be resilient as well. You're only as strong as your weakest link, so it's very important to make sure those you do business with also have health and safety. Lastly, I'll show you the topics in level 3 before we move on. This is the advanced level. And again, this is where you're going to be optimizing your health and safety management system. So topics such as internal audit, management review, health and safety continual improvement planning are all about reviewing your system, identifying any gaps, and making improvements. Now, this is important to ensure you build continual improvement into your organization. You want a system that continuously identifies and addresses hazards so that you are prepared for the unforeseen and can respond quickly with processes in place. Okay, that brings us to step 2, which is develop. So you've picked your 5 topics for the year. You may have picked the COVID ones, which makes sense considering the situation we find ourselves in, or maybe you pick some other topics. Now you're going to implement those topics in your workplace. And this is where your provider is going to give you guidance, tools, support to really ensure that you're successful in implementing those topics. Now, once you've implemented those topics, you're going to demonstrate to the WSIB that you have done so effectively. Topics should be implemented following a plan, do, check, act cycle to ensure sustainability of your health and safety efforts. So you're going to work with your provider to submit evidence, such as written procedures, worker testimonial videos, and images to demonstrate your implementation. We want to know that the topics are truly living and breathing in your workplace, that they really are building that safety culture for you and ensuring that strong health and safety management system. We want to see that your employees are actively involved and that the topics are really making a difference. Now, let's say you submit evidence to us and we find that there might be some gaps with your evidence. What we're going to do is we're going to provide you with 60 days to address those gaps. So we're going to give you some feedback on what the gaps are and give you 60 calendar days so you can make some changes. You can maybe submit some new evidence to us to address those gaps. Our goal is to have every employer that participates in this program be 100% successful in every single one of their topics. Now, once you've implemented your topics and you've received validation from us, you will be able to earn a rebate if you're Schedule 1. And for both Schedule 1 and Schedule 2, you will receive non-financial recognition. Now, first, let's talk about the rebate. Again, this is available to Schedule 1 employers, which is the vast majority of you. And I'm going to tell you how you can calculate your rebate so you know how much money you can receive by participating in this program. So in order to calculate your rebate, you're going to need access to our Compass site. Now, our Compass site is secured access on our website. It gives you all sorts of great information about your premiums and injury history and all of that. It's not the open data tool safety check that the public can see. This has much more in-depth trend data on your business and worker-specific data that's confidential to you. You're going to go in there, you're going to get your prior year premium dollars. So that's something you're going to need to know. You're also going to need to look for your predictability. Now, your predictability is basically the degree to which your premium rate is based on your claims experience. So those employers with a higher predictability, which we consider 20% or greater, have a greater ability to impact their premium rates based on their claims experience. And those with lower predictability, so less than 20%, have a lesser ability. Their premium rate is going to be more based on their class as opposed to their claims experience. So if you have 20% or greater predictability, you will get 1.4% per topic. And if you have less than 20%, we're going to give you 2% per topic. So we're going to offset the fact that you can't really impact your premiums as much by giving you a bigger rebate. Then you need to consider how many topics you've done for the year. So the calculation would be your prior year premium. So in this example on the screen in front of you, you'll see that's $200,000 multiplied by 1.4%. So we're assuming this is a higher predictability employer, times by the number of topics, and we're going to assume 5 topics were completed here. That's a $14,000 rebate. Now, for those smaller employers, we have built a funding floor into our model. So you are going to get a minimum of $1,000 per topic up to 75% of your premium. So that means if you pay $7,000 in premiums, you're actually going to get a rebate of $5,000, which is pretty significant considering the premiums you pay, but also I think that's going to go a long way in terms of supporting your health and safety efforts. There is a cap on the rebate of up to $50,000 per topic. So the most you can get through this program would be $250,000 per year. You also will get badges from us. These are digital badges, so you can put them on your website, you can put them on your email signature, on your digital media. You can also print them, put them on the wall, put them on a truck, print them on your business cards. The badges are available to you when you join the program. So you will get a member badge as soon as you join the program. We will feature it on our Safety Check website. You can see the example here on the screen. We are featuring the badge that the town of Markham has received. And that's something that's really wonderful because, you know, again, right now, everyone needs to earn the confidence of their customers, of their clients, of their job seekers, of their employees in the health and safety of their business. And this is one way you can visibly demonstrate your commitment to health and safety by having this member badge. The other badges that you'll see on the screen are performance badges, and you receive those when you complete program levels. So you can get a badge when you complete foundations level, which is level 1, intermediate level 2, or advanced level 3. Those will also be featured on our Safety Check website. Okay, I'm going to talk to you a little bit about another feature of the program that you're going to get access to through the digital portal. So in addition to the financial and non-financial recognition, we also give you the ability to measure improvement to your safety culture. And again, safety culture is a key to recovery, one of the key themes of this presentation. So you'll see here a quote from Peter Drucker, Culture Eats Strategy for Lunch, and just want to highlight that again, that even the best laid plans will not succeed if you don't have a strong safety culture. So what we give you is a free culture assessment tool that you can use to really measure your health and safety culture. So this will give you a snapshot of how your employees really feel about the health and safety of your business. There's 13 variables within the assessment, so it's 13 questions for your employees to complete, and it's anonymous. It's very quick and easy to field. You can take the assessment when you first join the program to get a baseline, and then you can reissue this assessment maybe a year later to see the progress you've made in building that health and safety culture. We've actually had this culture survey completed by 500 of our employers this year across around 5,000 employees. And very interestingly, we have seen a correlation between those employers that had high scores on this survey, so strong health and safety culture, and no lost time injury rates, or no lost time injury claims. So those employers that had the highest scores don't have any lost time injuries. So that's pretty interesting and pretty impressive. And it goes to show that safety culture is really vital. Another thing we noticed was that those businesses that scored high on the survey had positive, really strong and positive results in trust, employee involvement, and employee empowerment. I'm going to actually walk you through an example of one of the employers that has enrolled in our program, Town of Markham. So Town of Markham is actually a Schedule II employer. I think there's only about 300 or 400 Schedule II employers in the province. Sorry if that's a little bit off. So again, not a lot of Schedule II employers, but wanted to use this as an example because this is an employer that even without the rebate, still chose to participate in the program because they knew that they would see quite a bit of return on their investment. So City of Markham had a number of challenges when they joined the program. I'm going to outline those for you. So like many of us, they had some COVID challenges. They needed to train the frontline staff. They wanted to ensure their employees felt safe returning back to the office and going out into the field. They needed some new PPE supplies. They also needed to develop some new COVID-19 related policies and procedures for different roles and different functions within the organization. And they needed to comply with those evolving government directives, as well as ensure the health and safety of their remote teams. So the City of Markham joined our program, and they selected a provider to work with. They appreciated the program flexibility. They were able to pick the topics that made the most sense for them, and then implement those topics to address their health and safety challenges that I mentioned on the previous slide. And they saw some really, really great outcomes. So what they saw was they saw cost savings almost right away. They saw reduced WSIB claims, less lost time injuries, less days lost, less costs associated with claims. They were able to align their health and safety program with their strategic plan, which really helps with that safety culture piece. They were able to improve their public image. and they fostered more of a health and safety workplace and community. Okay, so I'm going to summarize for you all that we just talked about. So we've just gone through the program in great detail, and I want to take a moment to really summarize these program features for you. So the program is really about helping you improve your health and safety and earn rebates and recognition and get a return on investment for doing so, keeping your employees healthy and safe and really building that health and safety culture. Through the program, you're going to get support from an approved provider to really help make sure you're successful. You'll also get access to a free culture assessment tool. You can participate in the program anytime, anywhere, because it is digitally enabled through an online program portal. The program's flexible, allowing you to pick the number of topics to work on for the year. The year can start whenever you want, by the way. This is a rolling program. So if you want to start the program in January or in August, either one of those is an option for you, whatever makes sense for you and your business. And it's a risk-based program. So we're going to actually help you get at those root causes of injuries and illnesses and hopefully eliminate them. And you're working towards that Ministry of Labor Training and Skills Development Accreditation Standard, which is called Supporting Ontario Safe Employers. One thing to note is we also do provide rebates for employers that receive that standard through the ministry. So that's something to consider as well. You will get the rebates as you complete this program, further rebates when you achieve that standard of excellence. Okay, so what is your next step? Well, we've got a few options for you. First of all, we are at booth 4 today. If you want to come and see us, we'd be happy to walk you through the program in more depth, even help you calculate your potential rebate, answer any questions you may have. You can also engage with us by email. We have an email that we monitor every single day. You can connect with us there. We'll have a consultant reach out to you. Again, help you calculate your rebate. We'll help you pick a provider, walk you through the program, make sure you have what you need to get started. You can also connect with providers directly. All of our providers are listed on our website. I will say this, PSHSA is actually one of our approved providers. They're hosting this conference. So if you are connected with PSHSA, and sorry, I should spell out that acronym, Public Safety, Health and Safety Services, they can connect you to this program as well. Also, we do host webinars daily. You can sign up for those on our website. I've got the link on this slide here. And as mentioned, once you join, you will get your member badge, which is something you can start promoting right away. Before we go, I'm just going to share one quick update from the WSIB. This is beyond the Health and Safety Excellence Program. This is just a general update for you. We have some new online services that may be helpful to you and your business. These are enhanced online services. Now, anyone can use our website to upload claim-related documents straight to their claim file. You have the ability to upload injury and illness and exposure incident reports. You can receive your claim files electronically, and you can review your claim status, latest payments and benefits, and send us messages online, so emails. So this is some great features that may be of help to you. Now, I think we'll open things up to any questions that you may have on the Health and Safety Excellence Program. Thank you so much for giving me your time.
Oh, my regrets, Diana. Thank you very much. That was a very informative session and very insightful on the number of different services and offerings that the Health and Safety Excellence Program provides. So we thank you very much for that. We were monitoring the chat throughout the presentation. There is one thus far, and I also have a couple of questions that are usual general questions about the program. First, I know that you talked about costs, but overall, is there a cost for joining the program?
Yeah, so the only cost for joining the program would be with the provider for their specific services to guide you through and ensure your success in the program. Typically, those costs are $500 to $1,500 a year, depending on the services you choose. But once again, the rebate will typically more than cover those costs. As you saw from the example, that employer paying $2,000 in premiums got a $14,000 rebate. So a cost of maybe $1,000 for a provider is really a small number compared to what they would receive.
Thank you. A second common question is, many employers obviously have already gotten started on revising and updating and creating COVID protocols. If they were to join the program now, is there a way that they can use this activity towards a credit towards the program requirements?
Absolutely. So we recognize that COVID is still ongoing. Although many protocols have been developed and procedures have been written, they haven't been fully implemented because we are still in the midst of the pandemic. So any employer that has already developed those procedures is more than welcome to join the program, select those topics, so they can select the control of hazards, the risk assessment, the emergency management piece, and they can continue to implement those procedures, continue to improve them, because things are evolving every day. We get new guidance and new directives, and we're moving in and out of orange zones and red zones, and so they can continue to implement those topics and get credit for them in the program. So it's not too late to join and get a rebate for all the great work that you're doing on your COVID-19.
Thank you. And once we do join within the program and submit evidence in relation to our topics, how quickly can I receive a rebate if I participate?
Yeah, so that's a great question. We pay our rebates on a quarterly basis. So the longest you would have to wait from the time that your topics are fully validated would be 3 months. So typically you would, a month or two would be your delay to receiving a rebate. But again, the longest it would be 3 months.
And last question, when I work on a topic, how long is implementation normally?
Yeah, so it really depends on the topic. So some topics have more standardized sort of processes, like first aid. There's a regulation in place, so it's pretty standardized in terms of implementing, your first aid kits and your first aid training. So that topic may only take you around 4 months, whereas some of the topics that could be more complex, that could involve a little bit more, measuring and making improvements, and could be just a bit more complex to implement, could take upwards of 8 to even 10, 11 months to implement, but within a year, you should be able to implement all 5 topics within your action plan.